Hello, I'm Dr. Kirman. Many of you have been asking our staff and our other associate doctors about age-related macular degeneration. It is the leading cause of vision loss over age 65. And February is Age-Related Macular Degeneration Awareness Month. And so I wanted to take the time to answer some questions and explain a little bit about macular degeneration.
We have a couple questions from some of our patients. The first, people want to know about the anatomy of the eye. So what is age-related macular degeneration and what parts of the eye does it affect?
Yes, well, if you think of the eye as a camera, the retina is like the film used to be in cameras. It is the anatomy of the inside of the eye. And the macula, if you think of the retina like a target, would be the bullseye of the retina. So the macular area is responsible for our best acuity, our 20/20 vision, and our best color vision.
Dr. Kirman, why is age-related macular degeneration awareness important to you?
Well, it's really hits home with me because I had a grandmother, my dad's mother, who lost most all of her vision to age-related macular degeneration back in the 1980s when I was in optometry school. So she unfortunately lived the last 8 years of her life clinically blind.
How many people does age-related macular degeneration affect?
Well, in the previous decade, it affected over 14 million people. And those numbers have come down somewhat because of the cessation of smoking. Smoking is a high risk factor, but it affects nearly 10 million patients a year throughout the United States.
Is AMD preventable?
We are working on those prevention techniques right now. Up until recently, most patients would present to our office or an ophthalmology office having already experienced vision loss. And so trying to preserve vision and restore vision has been something that our professions have been working on. Now there are new techniques, new instrumentation that actually help us to identify patients at risk.
Dr. Kirman, what lifestyle choices would you recommend to help people save sight?
Yes, well, that's a good question. And smoking is the number one high risk factor for age-related macular degeneration. So if you are a smoker, stop smoking. If you have never started smoking, don't start. Other factors that are very important are blood pressure control, diabetic control with hemoglobin A1C levels, and cholesterol control. Your body mass index and obesity have a role in increasing risk factors for age-related macular degeneration.
What type of special testing does Kirman Eye offer to detect age-related macular degeneration?
Well, we are very fortunate and blessed to have access to a new instrument that was designed through the Hershey Center for Applied Research. And in 2014, we became one of 28 offices throughout the country to work with this device for our patients. And we were the first in the country to use this instrument as a screening tool. So we started screening patients 60 and over, whether they had 20/20 vision or not. And so it's very unique. It's new technology that our office is helping to educate our colleagues so that patients around the state and around the country can have early detection and then early treatment.
One more question for you. How has the treatment for age-related macular degeneration advanced over the past years?
Well, I've been in practice for 30 years, so for 22 of those years, there was really no treatment for macular degeneration. It was a very sad sequence of events that would occur for the patient's family, and doctors. All of the caring doctors that wanted to help preserve those patients' vision were unable to do that. So there was nobody in the world that could help to restore sight or prevent vision loss. However, approximately 8.5 years ago, injection therapy to help restore patients' sight who have lost vision due to Wet macular degeneration, which is hemorrhaging in the back of the eye, is now available, and you may know of individuals that go in for injections monthly. This has been a tremendous sight-saving technique, and is certainly one of the modern-day medical miracles for patients. We are working with 85% of the macular degeneration patients that suffer from dry macular degeneration, where there's just an atrophy of tissue. And that tissue atrophies because of lack of proper nutrients to the retina itself. And so through the AdaptDX, the new instrument that we're working with since 2014, we're able to identify patients that are at risk. That's a 92% specific test. And we then place those patients on the same vitamin formula that has been proven in 2 different 5-year National Institute of Health studies that prove the effectiveness of vitamin therapy. Those studies were the Age-Related Eye Disease Study, or ARED studies, and there was one from 2001 to 2006, and a second from 2008 to 2013. And these studies proved the effectiveness of vitamin therapy to reduce patients' risk of progression of the disease. So we use that vitamin therapy now in hopefully delaying the onset and perhaps prevention. We're seeing some very exciting results with our patient population for those that we've identified as at high risk, and we're seeing in many cases just stable vision instead of increasing loss of vision from year to year. And we're seeing retinas that actually are improving, and scores of the dark adaptation testing that can improve. So there is a bright outlook for those patients that feel that they may be at risk for macular degeneration. Certainly anybody that has a family history is at risk, and I encourage you to do your reading, contact our office, and we'd be happy to help you preserve your vision.
Excellent advice. Thanks, Dr. Kirman.